Hello, my name is Mr. Nicholas Matthews. I'm one of the obstetrician and gynecologists at Sunderland Royal. A particular part of my role is the lead role for oncology, which means that myself and the team that I work with look after women with suspected or proven gynecological cancer. I'm very fortunate to work with a small team who provides services on both sites. The team consists of myself and another gynecologist and two clinical nurse specialists. And the four of us work closely together to coordinate care across the both sites. We're also fortunate to have an input from other colleagues with a special interest in gynecology, especially in the diagnostic part of it. That means, you know, where ladies are sent in with symptoms and need a diagnosis. Women with symptoms suspicious of cancer are referred urgently into our service, and the first look that we get is on the referral from your GP. That allows us to make a decision as to how quickly we see you. It also makes us a decision of point of care investigations. Sometimes we order ultrasound scans, sometimes we order CT scans, and these all go to help make a diagnosis as quickly as possible. Just recently the rules have changed, and what our team hope to do is provide you with a diagnosis within 28 days of your referral from your general practitioner. When you're referred to our clinic, we call the clinic a fast-track clinic or a rapid access clinic. And during those clinics, you're seen by a clinician. You may also be seen in our radiology department where you have various scans. And if we feel any other investigations are necessary, these will be organised at the time of clinic, but it may also, they can be organised afterwards. Sometimes these clinic appointments go on a little bit longer than a general gynecology clinic. That's because we try to get as much information as we can during those appointments. If you do have symptoms worrying of cancer, or you do get a diagnosis of cancer, a referral is made to the QE, the Queen Elizabeth Hospital in Gateshead, and that's our local cancer centre. And it's there that we have meetings every Monday where we discuss each case on an individual basis. And this is known as an MDT system, or a multidisciplinary team system. And I think, you know, that's excellent for women, because it means that one person's not making a decision for their care. We get a consensus of the best care for all the ladies referred there. The MDT process is not a process where we expect a patient to turn up. It's really an exchange of information, and there we make a decision about the best form of treatment. This is a real advantage for women in this area, because it means that it's not just my opinion, it's not just sister's opinion, but the specialist team make an opinion as to what treatment to offer. Once a recommendation is made by the MDT, this will be communicated to you by our clinical nurse specialist. This is done on the day of the MDT or the following day. Sometimes your care will be transferred over to the Queen Elizabeth Hospital, and sometimes surgery or treatment will be carried out at Sunderland. A lot of that depends upon the cancer that you are diagnosed with. If your care is transferred over to the Queen Elizabeth Hospital, we do transfer your care, and all further investigations and surgery are carried out there. However, on your first appointment, we really do try to make sure that you're accompanied by one of our clinical nurse specialists, as we feel this provides a great deal of support for you. Even if your operation occurs at the QE, it may be that we see you afterwards in terms of our follow-up to check that you've made a good recovery, to check that everything's up to date once you've had your surgery, and to check over the coming years that you have no evidence of any recurrent disease. Although our clinics do run on an appointment basis, once you've been referred to us, we are always more than happy to hear from you if you have any symptoms of any concern. In these cases, all you need to do is contact our clinical nurse specialist as the first point of contact. She will then make a decision as to whether to give advice over the telephone or bring you back to clinic for further review.